We want to welcome everybody to our podcast. This is the Tech to Exec podcast where we discuss with IT leaders about their technologies and how that really fits into the executive boardroom and how to bridge that gap. We talk about AI and we talk about cybersecurity and we talk about really how technology solves the problems that executives want to solve. Today, we're joined by Ryan, who's a chair of Proofpoint's Health Advisory Board, and we're super excited to have a discussion around healthcare and cybersecurity, which is a hot topic. So, Ryan, first of all, welcome. I'm Mike Linton. I'm CEO of Valcom, and
And I'm
we have
Josh
Josh.
Linton. I'm the CIO of Alcom, and we're excited to have you on board. We'd love to have you kind of just start us off. Tell us a little bit about yourself, maybe a little bit about your kind of how you got to where you are now, and a little bit about what you're doing at Proofpoint.
Great. Hey, it's good to be here. Thank you for having me. I guess I'll start off with how did I land in technology? Sometimes you're just a victim of circumstances. Sometimes it's a good and bad thing. I actually grew up in the heart of Silicon Valley before it was Silicon Valley. So I think the apple orchard that was outside the house where I used to play, hide and seek and all that, ultimately became Infinite Loop, which was Apple's original headquarters. So you kind of fell into technology because it's just, in the same way, if you worked near a coal mine or a factory, you would fall into, working for one of those places. I've been in technology pretty much all my whole life. I found my way into technology, applying it to healthcare about mid-career when I just found myself gravitating more and more towards healthcare institutions, and I think really being quite, quite consumed with the mission and the people in healthcare. And there's just these people who have some of the most noble missions on the planet. They do really, really great work. Pretty much, if you're in healthcare, you could choose to make more money anywhere else, whether you're in marketing or administration or you're the receptionist or whatever, you can go make more money elsewhere. But people just go to healthcare, they stay in healthcare. And I think it's something about the DNA of the people that I really, really gravitated towards. And I've been doing this for, running advisory boards for the best part of 15 years, most recently for the last 9 at Proofpoint, where our customer advisory board has been the linchpin for so much that we do from a product development standpoint, from a go-to-market standpoint, and just really trying to understand the industry and the challenges and how can we make what we do at Proofpoint more relevant to those industries and to those challenges.
Talk
So
to us about that healthcare advisory board with the customers. Like, how do you set that up, and how have you got the most out of that? I think that's really fascinating, something different than others that we've spoken to do. And so, I'd love to hear if that's something you started or you took over. Like, talk to us about the genesis of that, and then what's made those effective, and how do you get the most out of that?
I did found it. It's the fourth board I have founded, so I had a little bit of track record about how to do this. And admittedly, it was kind of a challenge, at least initially, about having the conversation with Proofpoint. The propensity for advisory boards is they turned into kind of glorified marketing and sales meetings. And I just said, hey, look, we shouldn't do that. We shouldn't run an advisory board. There's no obligation for us to run an advisory board. The market's not demanding it. This is our choice. If we're going to choose to do it, then we need to choose to do it right. And Proofpoint, to their full credit, said, "Yes, you're right. Let's approach it in the way you're describing." So I have this philosophy, which I call a share, shape, speak format. So I try to create an agenda or a mission that's really oriented around these 3 pillars around share, shape, and speak. Share being what are we going to tell you? Like there are things that we want to communicate to you. It could be about our roadmap, it could be about something that we're developing. We want to spend that time sharing with you something that we're doing. Shape is all around preparing you, our advisory board, with topics that we would like to learn more about, that we're wrestling with, that we're more curious about. So we will put together a brief or an abstract and say, hey, come prepared to the next meeting with thoughts on these various topics. And then lastly, it's the speak format where it's like nothing at all about what we want to talk about. Now it's all about what do you want to talk about? And so by having those kind of three distinct pillars or swim lanes, if you will, it gives us a very broad narrative to tackle things that we feel we need to tackle, get feedback on topics that we feel we could evolve on, and then also just learn what's top of mind for healthcare cybersecurity executives, and things that we thought would be interesting and topical. All of a sudden, they come out of left field. You're like, wow, that's a really profound idea. We didn't think about that. We're really glad you brought it up, and it's opened up use cases, opened up new markets. It's actually led to acquisitions. Like, okay, that's a technology capability that we probably really ought to have as part of our portfolio or something that we need to be thinking about. So it's been a very, very, very fruitful conversation on just multiple levels.
And have you been doing this for 9 years, and how often do you do them?
So I've been running we're going our eighth year for the Healthcare Customer Advisory Board. And then in 2024, I started an advisory board for higher education. So we meet once a year in person, and then we meet 3 to 4 times a year on Zoom or whatever, where we take these essentially this format and apply it to these sort of meeting formats.
Oh, I love that. We've dabbled in trying to make a really good one for our customers, and this gives us a framework to do that. So I think that anything else you've learned as you've done these, and this is very valuable to us as far as how do you really get the most out of this. And I imagine it is giving a lot of value back to the customers. They hear the other people in their industry talk about best practices, and even so, yeah, I'd love
Right.
to hear any other insights
There's a little bit of field of dreams. If you build it, they will come sort of attitude you have to have with this. Because sales and marketing obviously want to do the best we can to monetize it, to show ROI. And my philosophy has always been like, look, if we keep doing these things and if we keep showing the value we're bringing to the community, to these advisory board members, kind of like trust the process, build it, and they will come. And we could show strong, it's not about revenue growth, but we can show strong revenue growth for those customers who are part of our advisory board. What's way more important, though, is that we develop very strong, meaningful relationships with these individuals, and we develop deep, meaningful insight into what are the challenges that are facing the marketplace in a way that gets way beyond a presentation and in a way that really gives us tremendous sort of insight. And so I talk a lot about an elongated engagement. Sure, our CEO or our chief product officer can be in town and can come meet you for 45 minutes, grab a cup of coffee, or can present to you over Zoom, or you can engage, right? But when you have it in an advisory board setting, what ends up happening is you have maybe a conversation that starts in a formalized, hey, we have a one-on-one meeting, diarized prior to before the program started. And then before you know it, well, they ran into each other for a cup of coffee. And then they decided to, you know, have breakfast together. And before you know it, an idea that started in a one-on-one meeting had an opportunity. Both people go away, they think about it, they come back and say, hey, you thought about it from this point of view. And then all of a sudden you're taking a conversation or one meeting, and one meeting kind of rapidly comes into maybe 4 or 5 meetings over the course of the engagement because you have the time to do that. And so this is where we do really learn a tremendous amount because we're able to facilitate, we have an enablement to go way past just kind of scratching the surface and learning about it. And then we're going deep into almost problem solving or the opportunities. Hey, how about if we were to think about it from this sort of perspective? And so
Oh,
that
I
framework's just been really powerful for us.
I love that
Amazing.
framework, and I love that you have to get sales and marketing out of it, and that's what makes it valuable, but then they do get value out of it. So
They get value out of it. And I try to make it a little bit fun. So I started off initially, if you're got the World Cup coming up. If you're fans of soccer, I would give everyone a yellow to red card. So like if we get two sales, you can kind of like card us, like put us on notice type thing. Um, and when you know it really works, at least one way you can know that it really works is about year three, we started getting pressed by our board members to include their plus ones. It's like, hey, this is
Oh,
like, we feel like we have a community here. Like, we really want to bring our significant others to be part of it. And so by year five, I would say two-thirds of attendees are bringing their plus ones.
and
Um,
how long are they on the board? Just as long as they want to be, or how do you guys do that?
we um, we have the board. Ostensibly, it's somewhat informal by design, so no
Hmm.
one's signing anything. There's no
Yeah,
honorarium attached to it. We like people to commit for at least 2 years, um, and best endeavors to attend one person in-person meeting per year. Sometimes stuff happens, life gets in the way, and you can't always, but that's the model. And then, we will look at how over time you need to refresh for all sorts of reasons. People
sure.
move on, people have different jobs, people want to, do go different directions. So we probably refresh every maybe 3, 4 to 5 years, something like that. Some of it, we've had a couple have been on board for all 8 years. And it's
Well,
just been valuable from their standpoint. We see a lot of value in maintaining them. So again, it's not a hard and fast rule, but that kind of we try to freshen it up occasionally.
And just to narrow in on all your best practices, what's the optimal size that you shoot for?
Oh, I have strong views about that. You want to be right around,
Yes.
from an in-person meeting, you want to have right around 15.
Okay.
Because
Any other
any more than that, it starts to break into two meetings. It's hard to manage more than 15 people because essentially, in most cases, you have a room full of alphas, right? So everyone wants to express their point of view, and that's really, really encouraged. If you get too many, then it's just hard. You have too many side conversations and you lose track. So 13 to 15 is optimal. Below that, it starts to feel a little Spartan. Above that, it's unwieldy. So in that sort of sweet spot.
any other strong opinions around advisory boards that you have where you're like, hey, it's got to be 13 to 15 and one time a year in person. Any other like, yeah, this is what makes it great.
Um, I would say a couple things. Number one is like, this is the best investment you'll make. Pay for people's travel to not we pay for everything bar airfare. So we expect people to pay for their own. But one thing we do throw in, which is that not normal, is we throw in the transportation from the arrival airport to the venue. So that might cost us a few $1,000s. You think, well, why would you do that? I mean, partly we do that because we want to provide a white glove experience, but it's also somewhat self-serving because if you pay for people's travel from airport to the venue, guess what? You get to ask for their flight information. And if you have their flight information, that's a very, very strong indicator of who's truly going to show up.
hmm.
We don't have like, oh, well, we want to aim for 15, we got to invite 30. We don't have that problem. The people who don't show up are like, hey, I had a last minute problem. I have a cyber event or I got the flu or something happened. And so we know very, very reliable predictors coming into the last, say, 2 weeks before the event, who is truly going to be there. And we have that because we have their arrival information. We have their flights, and we can say, okay, so and so is going to meet you. So it's worth the it is worth the investment from a
And you,
predictability sort of standpoint.
and you've made it so valuable. It sounds like people want to come. They want to be part of this group and this council. And I bet you didn't know that we were just going to dive into advisory councils on this call. You thought we were going to talk about healthcare security. Uh,
It's a topic I'm very passionate about, so I'm very happy to talk about it.
I think it's
Sounds
something
like
that's
it.
underutilized and underappreciated because we do let sales and marketing get involved. And we love sales and marketing. We think their important function, but nothing replaces hearing what the customers are really thinking, what they're saying in an environment where they can really discuss their thoughts. And what stuck out to me when you said, "Hey, we found acquisitions, we found new directions for our company that because of the advisory council done right." I think that's valuable for all of our vendors and all of uh, us as value added resellers as well to know there's a way to do this right and to add value both to the our clients and to ourselves. So
It's just been so enlightening. I agree with everything you're saying, and it's been so enlightening. So much we have today that is broadly part of the Proofpoint go-to-market motion. So how we build out our packages in terms of like what do we include in our offerings? What offerings do we focus on? What offerings? How do we price them? How do we evolve our contracts? A lot of that started with the advisory board because the advisory board was the first sort of insight into, hey, this is something that's actually not working well enough or could be enhanced. And this is where like the speak format of it is really, really valuable. We had one advisory board where we spent an hour on contracts. We had no
Wow.
idea we had a contracts issue, but we learned pretty quickly to what degree we had a contract issue. And so okay, yes, we need to think about this. And this goes back. I'm going back like this is one of the first things we actually ended up talking about. So I'm going back maybe 7 or 8 years now. But so it's like, but like, thank you. This level, this has been really, really helpful. And then you realize, oh, okay, probably others have this issue as well, and we need to look at that. And
I think
we evolved our enterprise pricing model in a similar manner. It's like, oh, okay, we thought we had this solved, and we clearly the marketplace doesn't agree with us. We need to go figure that out.
that's
So
amazing. I think it speaks volumes about how much the customers, and we know this, that our customers love working with Proofpoint. They love the product, and I think that it shows that you care about what they think, right? And the product's getting better, and the customers continue to invest in the product. They trust it, and I think it all kind of comes around, right? And what a huge benefit to them and to us and you guys.
yeah, I look, I think I do a good job running the board, but I have to give full praise to the company because the company is had the willingness to go on this journey, willingness to go hear some things that were sometimes painful, or if it's not painful, things they don't, topics they don't necessarily want to focus on,
Yeah.
but they're still willing to go through this journey and they recognize that we're all better for it. So Proofpoint's been wonderful in building that platform and sustaining that platform. And I could talk about advisory boards forever, but I'll give you an opportunity to move on to a different topic.
uh,
One of the things that's been really valuable through this process, particularly now when we think about the world of AI and how things are evolving, is the particularly in an enterprise market engagement sort of construct, personal relationships really still really, really matter. We learn a tremendous amount by just talking with people, establishing trust with people, them trusting us. In the world of AI, where we're trying to automate as much of this that we possibly can, we're trying to bring as many agents on board to go solve for many aspects of everything from support to product dev to marketing to demand generation, and I guess, some forms of market engagement. Like personal relationships still has a huge place in the world of enterprise IT, enterprise cybersecurity. Make no mistake about it.
We agree. We couldn't agree more. I think our whole business is built on relationships with great vendors like yourself and also with our clients, and they still want and need that and know that somebody has their back and know that we care about their problems and we're trying to solve them as much as they are, and we feel a responsibility for that. Where have you learned that? So client relationships matter. Any examples of where you've seen that make a difference for the client as you've built that relationship? And I know advisory board's one way of doing that, but we are in this world of AI where people don't have to connect as often as they did, right? You no longer call and say, "Hey, what's the best in the world? Like, what's the best solution here?" Or call your buddy and say, "Hey, how do I solve this problem?" You just put it into chat or Claude. Um, yeah, any insight it sounds like you've thought through that. Any insight on where AI can help with that, and also, and I've asked like three questions in this one question, and really where you've seen the client relationship really matter.
I think where AI helps a lot is whatever topic you're trying to resolve or solve for. You can go from whatever 0 to 60% pretty darn quickly, So the whole blank space or blank page sort of syndrome, like that does not exist anymore. Like AI can get you way off the like, I'm not sure where to even start, sort of. So that's great. Absolutely fantastic. And that's applicable in so many places. Um, where relationships really matter is when you can start to dig beneath, wait, what are you trying to solve here? Like, what are you really trying to solve for? Um, uh, you know, I had an engagement recently. I'm trying to think. I want to tell this conversation in a more generic fashion. I just want to be respectful of what was shared with me. And it was clear that on email, there we just didn't quite understand what the problem that we needed to address was. And it's not exactly a revolutionary sort of concept, but getting having the conversation and then, that conversation led to that light bulb moment. Like, oh gosh, I get it now. I totally get what you're trying to achieve. I didn't get it before. And sure, that can happen at a conversational level if you just engage. Where relationships matter is people feel enough trust to actually expose what's truly driving them. So they trust you as a person, they trust you as a vendor, and so frequently in these engagements, their personal agenda really drives a lot of what they're trying to achieve. So yes, they have a company a, a cybersecurity problem that they're concerned about for their company, for their health system, whatever. Um, and there are multiple ways they can solve for that. So, but when you really then start to dig into, okay, how do you want to solve for that? Then you realize and you start to get some sort of perspective on what are they truly trying to achieve? And often what are they personally trying to achieve? They might be trying to achieve, you know what? I want to show I can bring a new vendor onto my environment. I want to be able to demonstrate I have that skill. I want to be able to demonstrate I have the ability to rip and replace an existing a current vendor and bring out a new vendor. I want to be able to demonstrate that, hey, look, I feel very uncomfortable. I don't know this area very well. I don't want my boss or my company to know that. So I need you to help me coach me about how do I bring this. Or they might want to, we see this quite frequently. I need to go get, for me to go achieve what I need to achieve, I need to go get board level buy-in. So I need to go ask for funds extra to what's budgeted. So help me go shape that conversation. Help me go build out the narrative, the slide, whatever it is, to go up level what I would know. Cause I up level, so I'm not having a geeky cyber speak sort of conversation. I'll be able to translate it and that into risk, into connection to the mission in a way that the board is more comfortable receiving that information. You
So
were
I want to double click on that because
right.
I think what you just said there of helping your clients go have the risk and board level conversation, how does that really happen in practice? Meaning they want to go and say, "Hey, we need this tool and because it solves this problem." How have you helped or seen clients take that journey where the CIO is now presenting to the board, or the IT manager presenting to the CIO in a corporate speak? Because I think that's what there's sometimes a gap there.
We had a Nirvana moment. Um, I would say, I don't know, a few years back now. I don't know when it was, doesn't matter. And we we realized that this is now very much a healthcare example I'm going to give you. We no longer need to speak in terms of HIPAA, in terms of compliance, in terms of making sure you're on the right side of the regulators. Sure, it matters. Okay. And we also can't just speak in terms of, hey, if you don't do this, you might get this multi-million-dollar fine. Or if you don't do this, you're going to get significant breach and your brand erosion. All those things, of course, matter. The Nirvana moment was when we said, what is healthcare truly about? And it's about patient care, solving, it harkens back almost to the Hippocratic Oath. Do no harm, do no harm. And it's the recognition that a cyber event actually can do harm to a patient. It can do a harm indirectly because you're causing them anxiety because you've exposed their data to the world and they now have to deal with that in addition to whatever else they were visiting you about. Or it can handle it very, very directly because, as unfortunately has been the case, has been very documented multiple times, somebody could be mid procedure, like I don't know, going through, a course of chemotherapy, and then their system gets hacked, and they that health system lose access to the patient record for a month. You're like, okay, how do I recreate the dosage that the chemo patient, the patient already has cancer. It's already traumatic enough, and now you just entered this huge new wrinkle. So connecting cyber events to it is related to your mission. It's related to your ability to provide patient care. And then seeing the board then have a light bulb moment. Again, not that they were not disinterested about losing money or the erosion of the brand or whatever, but right away they're like, that's what we're all about. If we're not living up to this mission, we don't, there's no need for us to exist as an entity. So that connection and showing the risk related to that very, very connection back to the mission that was our Nirvana moment. And that's where we really helped a number of our customers go not only unlock funds, because that's one thing, but actually unlock and get buy-in at the highest level so that physicians and doctors who don't want to disrupt their workflow, they do things in a certain way, and showing them that no, we're actually adding to your workflow in a way that makes you not cause harm to your patients.
That's amazing. And how did you get the kind of the buy-in from the IT team or the people, your customers, your direct customers, were they asking for that help, or did you kind of guide them to that?
A little bit of both. Um, a little bit of, yeah, some of it's, they're trying to solve for a problem.
Hmm.
And so much about market engagements, whether you're in sales or marketing, is problem solving. So they're trying to solve for that problem. And then also just through being very active in the community and just sharing, hey, we've seen this work elsewhere. Your peer is doing this. They're approaching it in this way, and this is how we've helped them. And then again then having the trust to say, hey, I want to try that for us. That sounds like that approach might work. And then so they're just developing the narrative, developing some material that we think lands very well
Hmm.
for that community, and then just helping them with those tools and how they can use those tools for their own environment.
That's
That
amazing.
it's arguable that healthcare is one of the most important things that we have, right? Our health is everything. And protecting that with cybersecurity is probably one of the most important things. So cybersecurity in healthcare becomes critical importance because lives are on the line. And you're on the forefront of seeing healthcare organizations that believe that and healthcare organizations that probably don't, that take cybersecurity seriously and some that don't. What's the difference between them, and what would you want every healthcare executive to know from your point of view if you could get them all in a room and share what about cybersecurity and what you would want them to know?
I think the thing I would want them to know, and I don't want to repeat myself, particularly for your podcast, but that you are in the most, arguably the most important industry on this planet. Um, this is why I work in, this is why I just love working in healthcare because these people, they do the most noble mission. Um, and you do all this tremendous work around building out your care capability, bringing on new devices, new ways of treatment, investing in um, new modalities, et cetera, cutting edge of so much. What we see is on a cutting edge of innovation. Do not fall at that last hurdle by giving it a less than robustly secure environment so that everything, all the great work you do, it gets unraveled so quickly because you haven't done the right level of protection in your environment. Um, Unfortunately, and I will never, I will never, it never ceases to amaze me how heinous a threat actor can be, right? There's no barrier that's too high or too low for them to them to exploit, for them to go monetize their threat activity. Um, uh, and so make sure you have that most robust protection in place. We had this situation back in time of COVID, and it's not. I don't want to talk about COVID per se, or it's not that this example is not still relevant. But we found through our research that those people within your hospital or your health system that were involved with end of life care, palliative care, etc., for whatever reason, at least at the time we didn't understand the reason, were some of the most heavily attacked people in any health system. And we're like, wait a minute, how could that be? I mean, we're very used to people who deal with money across all industries being heavily attacked. Of course, they want to redirect payments, they want to intercept, all that's fine, that's understandable. Health systems who deal with research, so yes, there's IP theft, and those people are always heavily attacked. But why in the world would somebody who is involved with end of life care be attacked? Well, unfortunately, it's for the same reason that pediatric care institutions are heavily attacked. People at the start and end of life generally are not too consumed with their identity. Parents are rejoicing over the birth of their child. It's a wonderful experience, and it's a frantic experience, frenetic experience. You're not thinking about, oh, I have to go establish that patient's my child's identity. Same thing is true for end of life. You're not thinking about, oh, well, so and so had this weird email came in. So as a result, it's a great patient theft is a great data theft from a patient is a great way to establish false identity. And people at the beginning and end of care, those people are the most easy to exploit because no one's really paying too much attention to that. You focus on way more important matters. Threat actors know that. Threat actors can be really, really heinous. And
Mm.
so I feel like I'm kind of going off on a tangent here, but I'm trying to explain, like, show just illustrating back to the healthcare institution and then go back to your question, like, they will exploit these weaknesses. They're very, very good at determining where weaknesses exist and can occur, and they do an amazing job. I don't want to say anything they do is amazing, but of trying to exploit that.
Very good at it.
And so we have to be very, very mindful as a community. Like your weakest link needs as strong as protection as everywhere else. Don't just assume because these people who are sometimes, third party workers or whatever, or they don't need the same level of security training or security tools. They absolutely do. And maybe more so given the level of activity, threat activity we see in those areas.
I love that example. I think as you're sharing about kind of your passion towards healthcare, especially around cybersecurity, this idea of really protecting the weakest in the community really resonates, right? And I think that it's in whether it's cybersecurity or really any other area, such a it's rewarding to be part of that, and we can see kind of the passion that you have, for that. Is the and I know we just have a few more minutes here, but what what is one of the big things that's concerning to healthcare industries that you've heard from your board or for whatever, just as we kind of head to the end here, and then we can talk. You can talk a little, give your last thing that you want people to hear, but what's one of the biggest, maybe newest concerns that you're seeing that you guys are trying to tackle and to support the healthcare industry specifically?
I think the thing that I find very concerning right now is we think about AI and the concern about AI and how's AI going to work in a cybersecurity context. And so I think the industry sometimes gravitates towards, okay, we have to prevent against AI style attacks. An AI style attack really is an old school attack just on turbocharged, way more pronounced. People are still the thrust of the majority of cybersecurity activity. They're attacking humans. They're attacking each one of us. They're attacking the way we work. They're attacking us on the platforms that we're most prevalent on. And they're doing so with AI charged exploits that are really, really, really hard now to determine that they're malicious or fake. Um, and because that's the level of tools now, they all the telltale signs of the past, a misplaced comma, language that doesn't quite look right, language is not reflective of the person, that person's job function, etc. Language is not reflective of healthcare. Um, are those are all solved for now. And when you get asked to redirect to a, hey, come check this out here, and get pointed to a site that looks eerily like your own company's internal, SharePoint site or whatever, collaboration site or whatever, and it's just really, really, really hard for people to make that determination. So that it's a malicious attack, so or malicious sort of email. So I'm still really, really concerned about that. That we as a broad community still haven't solved for that. The people being attacked is still going to be what plagues us going forward. And AI can solve a lot on the attacker side, but it can also solve a lot for on the defensive side. So I am excited about how we can use agents here now to marshal the defenses, because essentially at the end of the day, this is going to become an arms race. I think the defenders have deeper pockets than the attackers for the most part.
Mm.
So I like to make sure that we're putting the right level of investment in place um, to make sure that the healthcare has the right sort of defenses in place. And this kind of goes back to do it because it preserves your mission. Do it because you need this level of protection because your mission and your institution really respects or deserves that, demands it even.
Ryan, thank you so much. I think this has been really beneficial to me and our company, Valcom, and we are one of your partners, and we super appreciate your diligence in taking care of our customers and having a product that really does solve many of the concerns and many of the human concerns, right? And it does allow a tool to allow us to be less vulnerable to these attacks. And so thank you for your work you're doing here. We can tell you're mission driven, and that is really it's a really great to connect on this. We really appreciate both the partnership and your time. We So just today, I've learned how to make an advisory board effective, what to watch out for in these recent cyber attacks that are still going after the human, and then how important healthcare is and how important it is to protect it. I think our listeners will love to hear what's being discussed here. So I really appreciate your insights. And any last things you would want executives to know or IT admins to know about cybersecurity and healthcare? Anything last come to mind before we sign off?
I mean, I think I covered a lot of it. First of all, I want to say one thing. I appreciate your kind words. This is a topic that I'm very, very passionate about. So I'm glad that that passion comes through. I do this because I love it, not because I am very, very passionate about this, and I'm very passionate about advisory boards, the whole thing. So I do it because I love it. I am mission led. Um, you know, occasionally I hear that we're a small little community hospital. We're a critical access hospital. We don't have any money. No one cares about us. We're not a target. You're a target. And I try to remind people of the seminal target attack of I think it was Thanksgiving of 2014, where they breached millions and millions of visa. And the way they got to those visas was breaking into the HVAC call home system. The point being is like you wouldn't think about you have to protect that, and you wouldn't think about that a small critical access hospital needs protection. Yes, they will find their way in. So we're all targets. You don't have to be in New York City to be a target. You could be in the middle of the country and also be a target. So just keep that into mind.
That's a wonder.
Vigilant.
That's be vigilant and know where. Yeah, because that's the way we justify not spending money on it.
Right.
Ryan, thank you so much. Josh, anything else you want to?
I don't have anything. It's been a delight. Thanks, Ryan, and really
Likewise.
appreciate you and in our partnership. So.
Thank you. I
Thanks.
appreciate it.